So we also focus on what's bothering the person. If he says that, for example, when he bends forward, he feels pain, then we observe how this bending happens. Here, for example, you can also take a look right here. So when we tilt the head, during the tilt, the head moves a little to the side, and we can observe why this happens. So during the movement, the head moves forward, it goes symmetrically, then shifts a little to the side. It could be due to different muscle lengths, extensors, or maybe different joint mobility. We'll figure that out and determine it during the treatment process. And maybe this upper part of the muscle stretches differently, meaning the movement here is the same. As you continue the movement, you need to tilt your head a bit to the side so the movement can continue. Especially if this is bothering the person, we will focus on that during the treatment process. So lying on your side, we get access at the same time to the group of muscles located between the shoulder blade and the spine. Here we can work very well on the lower trapezius, the middle trapezius, the upper part of the trapezius muscle, and the rhomboid muscle. We can work on increasing the mobility of the shoulder blade, even affect the costotransverse joints and increase the mobility of the ribs relative to the spine. But most importantly, in this position we can work very effectively on this entire group of lateral neck muscles, starting with the trapezius right here from all sides. We can work on the trapezius muscle with you. Here is the scapular spine, starting right from it, right here, right under the trapezius muscle. The infraspinatus muscle is located here. If, for example, a person has some shoulder problems, we can also work on the infraspinatus muscle in this position. The supraspinatus muscle as well. We'll get to the neck itself later. This is a very good access point to the neck muscles. Here on top, we have the trapezius muscle, and this very top layer also helps stabilize the neck and maintain the position of the neck and head. Underneath it, there is already a deeper layer. So if we need the muscles to be a bit tense, we can stretch them like this. For example, we can use some fascial techniques like this. Yes, we can let the head hang down like this. If we need, for example, to work on the muscles, eliminate trigger points, or if we need to work on some deep muscle layers. So it's better to start not from a position where the muscles are stretched, but from a position like this. Here it's better to put your hand under your head like this when it's straight. Because if it's bent, it kind of causes some tension in the neck muscles. Or if you can't use your hand, if your mobility doesn't allow it, you can put a pillow there. And here we get access to all these neck muscles. Here we can work on them, starting with the trapezius muscle from here. So we start here, and right away we look for more painful areas, any areas of tension. Right here, where the angle of the scapula is, we find the beginning of the levator scapulae muscle, the muscle that lifts the scapula. Almost in all pain syndromes, actually, in all basically pathological processes, in all osteochondrosis cases, in any neck disorders, the levator scapulae muscles are involved. That's why we definitely need to work on it, because often it's either tense or fibrotic, sometimes completely surrounded by connective tissue. Sometimes it even cracks a bit, you can feel it rolling like that. Here, you can divide it into 3 parts. The first part is the area that's right here, just next to the corner of the scapula. Right here, we work on it from different angles, from the side basically. Well, you could say from the side of the spine at this angle, this is where we find the painful areas. Here we can also work on the mobility of the trapezius muscle, which covers the levator scapulae muscle underneath. We kind of move this trapezius relative to the levator scapulae muscle. So we also need to assess this mobility. If it's restricted, we restore it from the other side. That is, we work on the levator scapulae muscle from this side like this. Then you can apply this kind of pressure on both sides at the same time. If there's a trigger point there, press and hold it, but make sure it's tolerable. From above, also at different angles, meaning here we can find various painful areas and indurations. Work through all of this, and in this way, this is the origin of the muscle that lifts the scapula from the angle of the scapula. Here we diagnose and work through it simultaneously. This middle part here, it's all located under the trapezius. You need to keep that in mind. The middle part, it often tends to be a bit fibrotic as well. This is the spot where you look for the problem and work through those areas. And the upper part is the one that attaches here to the top 4 vertebrae. It's usually thinner, but there can also be painful spots there. But here it's all close by. It's already next to the scalene muscles, and at the back, it's a different part of the neck extensors, the semispinalis muscle, the splenius muscle, and then the trapezius muscle itself. If we need to relax it somehow to relieve the tension or tightness in it, here we can use something to help us a little bit. Let your hands glide. This is all part of it. You don't need a lot of oil here, just a little bit, just enough to allow for a slight glide. You can use this part of your hand like this, so that it glides slightly, but not too much. And here we start by applying pressure, pressing into the tissues, and then slowly moving along the fibers. In this case, we make a movement like this. And here, at different angles, we can start from the spine of the scapula, and we make this kind of movement. So at the same time, we're working on the fascia, the trapezius itself, and also affecting the area where the fascia of the trapezius muscle is next to the fascia of the levator scapulae muscle along the spine of the scapula. So this is the area right here, also under the trapezius at the same time. Here is the supraspinatus muscle, which can have areas of tension, trigger points. At this angle, right here, we affect the trapezius muscle a bit from the front, right here, and then this part as well, you need to work it out quite well and quite often. So right here on the surface, the trapezius is on top between the trapezius muscle and the deeper muscles underneath it. Here we have the semispinalis muscle, the splenius capitis muscle, and the splenius cervicis muscle. So it's between these muscles. Very often there are also areas of tension and tightness here. So it's important not only to find the painful spots in the muscles themselves, but also between the muscles.